What causes gastritis? Irregular eating patterns may be the main cause of gastritis. When you don't eat at regular intervals, your stomach may produce acid in anticipation of food. This can irritate the stomach lining. But, are you the one who eats at regular times every day and still has gastritis? Please comment below. If no food is present, it may not neutralize the acid. Here are some ways irregular eating can affect gastritis. Skipping meals or having long gaps between meals can lead to increased acid production. This can irritate the stomach lining. Without regular food intake, the stomach lining can become more vulnerable to irritation from stomach acids. Regular meals help maintain a steady environment in the stomach. This can be conducive to healing if the stomach lining is already inflamed. Generally recommended to avoid acidic foods if you have gastritis. If you can't avoid missing a meal, at least drink a glass of water to neutralize the acids. This video is based on several research articles. The links are listed on the description page. Gastritis is inflammation of the stomach lining, and acidic foods can irritate the stomach lining and worsen symptoms. Consult your healthcare professional before changing your medication or lifestyle. Foods and drinks to avoid include citrus fruits and juices like oranges, lemons, limes, grapefruits. Tomatoes and tomato-based products like sauces, soups, salsas. Coffee and other caffeinated beverages. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Carbonated drinks. Spicy foods. Alcohol. Other factors which can cause gastritis. Infections. The most common cause is infection with Helicobacter pylori or H. pylori bacteria. This can damage the protective lining of the stomach. Regular use of certain pain relievers like aspirin, ibuprofen, and naproxen may irritate the stomach lining. Excessive alcohol consumption can irritate and erode the stomach lining, leading to inflammation. Severe stress due to major surgery, injury, burns, or severe infections can cause gastritis. Bile, a digestive fluid produced in the liver, can back up into the stomach and cause irritation. In autoimmune gastritis, the body's immune system attacks the stomach lining. Viral infections and other bacterial infections can also cause gastritis. Conditions such as Crohn's disease, sarcoidosis, and parasitic infections can be associated with gastritis. The stomach lining tends to thin with age, and older adults are more likely to have H. pylori infection or autoimmune disorders. In addition to avoiding these foods, it can be helpful to eat smaller, more frequent meals and to avoid eating right before bed. To alleviate gastritis, you can take several natural treatments, steps and tricks. Dietary adjustments. Eat smaller, more frequent meals. This can help reduce the burden on the stomach. Avoid irritants. Stay away from or reduce spicy, acidic, and fatty foods, as well as caffeine and alcohol. Incorporate healing foods. Include foods like yogurt or probiotics, ginger, and oatmeal, which can soothe the stomach lining. Even though some websites and videos recommend aloe vera juice, I avoid it as it can damage the kidneys. Fermented foods with probiotics can support gut health by introducing beneficial bacteria into your digestive system. Here are some popular fermented foods that contain probiotics. Yogurt is made from milk fermented by lactic acid bacteria. Yogurt is one of the most well-known probiotic foods. Kefir is a fermented milk drink similar to yogurt but with a thinner consistency and a wider variety of beneficial bacteria. Sauerkraut is a fermented cabbage that contains beneficial probiotics and fiber. Kimchi is also a traditional Korean dish made from fermented vegetables, usually cabbage and radishes, and flavored with various seasonings. Kombucha, a fermented tea drink that contains a symbiotic culture of bacteria and yeast. Miso, a Japanese seasoning made from fermented soybeans, often used in soups and other dishes. Tempeh, a fermented soybean product that is firm and can be used as a meat substitute. Natto, a traditional Japanese dish made from fermented soybeans, known for its strong flavor and sticky texture. Pickles. Fermented cucumbers can provide probiotics if they are naturally fermented, not pickled with vinegar. Fermented cheese. Some cheeses, like Gouda, cheddar, and mozzarella, can contain probiotics if they are aged and fermented. Fermented vegetables. Other vegetables like carrots, beets, and green beans can be fermented to create probiotic-rich foods. Lifestyle changes. Manage stress. Stress can worsen gastritis, so practices like yoga, meditation, and deep breathing exercises can be helpful. Quit smoking. Smoking can damage the stomach lining and increase acid production. Avoid NSAIDs. If possible, find alternatives to non-steroidal anti-inflammatory drugs, as they can irritate the stomach lining. Natural remedies. Probiotics. Consuming probiotics through supplements or fermented foods can promote a healthy gut microbiome. Herbal supplements. Supplements like licorice root or daigly cerisiinated licorice and slippery elm may help soothe the stomach lining. Honey. Manuka honey, in particular, has been noted for its potential healing properties for the stomach lining. Licorice or Glycyrrhiza glabra has anti-inflammatory and cytoprotective, protects cells, properties that may be helpful in healing the stomach lining. However, licorice can interact with some medications and cause high blood pressure, so it's important to talk to your doctor before using it. Slippery elm or Ulmus rubra has a soothing effect on the mucous membranes in the digestive tract, which may help reduce stomach inflammation and pain. Marshmallow or Althea officinalis, similar to slippery elm, marshmallow has a mucilaginous, soothing and lubricating effect that may help relieve gastritis symptoms. Curcumin, the active ingredient in turmeric, has anti-inflammatory properties that may be beneficial for gastritis. Ginger. Ginger is known for its digestive benefits and may help relieve nausea and vomiting associated with gastritis. Hydration. Drink plenty of water. Staying hydrated helps maintain a healthy digestive system. Regular eating schedule. Consistency in meal times. Drink at least a cup of water if you are going to miss the meal time. Eating at regular intervals helps prevent excessive acid production and keeps the stomach environment stable. Medication. Proton pump inhibitors, PPIs, reduce stomach acid production, allowing the stomach lining to heal. H2 receptor blockers, decrease acid production. Antacids, neutralize existing stomach acid and provide quick relief. Antibiotics. If H. pylori infection is present, a combination of antibiotics may be prescribed. If you have persistent or severe symptoms, it's important to consult with a healthcare professional for proper diagnosis and treatment. If you have not subscribed already, do not forget to click the like button and subscribe. Up above you see a video related to diabetes and health. Thanks very much for watching this video. Subscribe to my channel.